The first thing that's clear is that if you go on a severe calorie-restricted diet, then you will lose weight. There's no question about that. Though how much weight you will lose will vary from individual to individual. The real problem comes in maintaining that weight loss over the long term. Again, we talked about the defense of body weight, or the defense of the set point. And it's the case that when people go off a diet, they will tend to return to their normal weight, but in many cases they will overshoot and they will exceed their original body weight. So what we see is a phenomenon that's sometimes called yo-yo dieting, in that individuals who worry about their body weight and go on calorie restriction diets will lose weight, then rebound and exceed their weight, and they will do that repeatedly, and over time they will gain more and more weight. And this is actually very worrying. What we know from large studies of adolescents in the United States is that one of the best predictors of weight gain in the long run is actually participation in weight loss programs. In other words, it looks as though, in fact, so far from being a long-term solution for many individuals, possibly most individuals, it's actually counterproductive. And this type of calorie restriction diet, if it's repeated, will actually have a very poor outcome. So certainly we know that of those that are on diets, and even on successful diets, even for prolonged periods, if you look at them 1 year, 2 years later, the great majority of those will be back at their original weight, if not higher. It's possibly one of the kind of common myths. Of course, when you see individuals who are kind of marathon runners who take a lot of exercise, they're usually very thin. But if you're looking at this as a kind of way of losing weight, there are lots of problems with this. The first problem that you encounter is that when you go out and exercise, it tends to stimulate appetite. And so the weight loss that you might expect from the exercise tends not to be as great as you'd hope for. And indeed, often people actually put on weight when they start exercising more. Now, that's not necessarily bad. I mean, exercise has got lots of other good positive effects. It's got very good effects on the heart. And often the weight that you put on with exercise may be muscle, maybe kind of a healthy weight gain, if you like, rather than putting on fat. But again, it's got some downside in the long term. If you don't maintain that exercise, and if you don't maintain the energy expenditure during that exercise, what will tend to happen is that when you stop that level of exercise, that muscle weight gain turns into fat. And it also, maintaining that exercise also becomes more and more difficult as you get older, for all kinds of reasons. That, other demands on our life as we get older mean that we're not so able to carry out regular exercise. It's difficult to maintain that level over a long run. So again, you've got that pattern of weight gain that you've put on as muscle turning into fat when you stop exercising. It's also very difficult to kind of see this as an effective intervention for people that are really obese. They have particular problems in exercising for lots of reasons. For a start, I mean, the strain on your joints when you're overweight is considerable, and so you have problems of arthritis, knee problems if you get people to exercise, it's a strain on the heart as well. So looking at exercise as an effective intervention for solving obesity is difficult. Of course, it might be part of an answer, but it's not so simple.